Aside from today's storms, the weather is actually getting nicer. People are hanging out outside. Some are making plans for the summer, getting ready for friends and family visits. At the same time, COVID is still in our community. This graph shows the percent positive that has been increasing over the last few weeks. So today we're discussing how to keep transmission low as we're heading into the summertime. To do that, we have Dr. Cynthia Snider from Cone Health here with us, and she's talking about how we can all stay safe, keep it all under control. All right, so first and foremost, we saw those transmission levels. We just showed everybody a graphic about that and how it is increasing. So some people are kind of like, it's going to increase. Do I really need to worry about it? How likely is it that the increase this summer is going to be even more than what we're seeing right now if we're not careful?
So over the last 2 to 3 weeks, we are seeing anywhere from a 20% increase, and we suspect that over the next probably 4 weeks or so, we'll still have that steady incremental increase throughout the community.
Okay, so 20% increase is what she's looking at possibly happening if things stay on track, right? So let's talk about vaccines and boosters. I think a lot of people at this point in time, if they haven't had their vaccine, they're thinking to themselves, well, I can just get by without it.
Well, it really depends on how recent people have had their booster. If their booster was last fall, we really feel that is a great time. If it's been over 5 months, this is a great time to get your booster.
All right, let's talk about some common summer gatherings and talk about how COVID recommendations might kind of play in with that. All right, so this is one of the most common ones, indoor high school graduation. Masks recommended?
I would say yes.
Okay. How about those graduation parties that we're having with like extended friends and family and people that you just don't live with, but you see every now and again?
It really depends on where you're going to be having your graduation party. If it's outdoors, we know that transmission is low, but if you're moving it indoors and there's a lot of people where you can't really spread out more than 6 feet, I think it's a great time to consider asking people to test before they come together.
Test before you come together. All right. How about those summer camps, sleepaway camps? I know a lot of parents are looking forward to the sleepaway camps, the kids being able to go out this summer. What should they be doing?
I would say just make sure to follow the recommendations from the summer camps, especially for sleepover camps. I would not be surprised if they ask campers to test before they go. But the key thing is that if anybody's been in close contact with somebody, it is recommended to get tested anywhere from day 3 to day 5 from their exposure to that person. And especially if you are having any symptoms, it's important to test. Right now, there's still such an overlap between seasonal allergies that are still around and COVID. So I would not dismiss those, that nasal congestion as seasonal allergies.
Don't dismiss it. That is a really good point, because we all, of course, want to think first and foremost when we get that it is just an allergy. But we need to be careful with that.
That's right.
And you said test between 3 and 5 days if we know someone that we've been around had exposure.
Yeah, I think, the earliest would be 3 days. Probably 5 days is also great. And also with the antigen test, if you use it more than once, it increases the sensitivity of that test.
All right, let's talk about trips. There's a lot of girl trips and guy trips going on. If you don't live with these people, you're meeting them, at a vacation destination. Should everybody be testing beforehand?
I would say yes, because then you don't necessarily, expose anybody else unnecessarily. And then also what's also vitally important is to make sure you're masking before you go out on your trips. So if somebody's about to fly to go out internationally or fly to another destination, those few days before you get on that plane, and as well as at the plane and the airport, even though it's not required to masking gives you the best protection.
All right, so we've been through this for the last 2 years or so. Many people, though, are confused at this stage about how to deal with COVID because so many things have changed. Let's talk about the right steps. If we find that we are COVID positive, how long do we need to isolate?
So the isolation really depends on, the CDC is requiring at least 5 days. So in that calendar days, that's the day after your onset of your symptoms. So let's say if I start having symptoms today, it's day 0, tomorrow's day 1, and then you count from there. However, if you could stay home for 10 days, I think that's the best thing. But obviously, a lot of people have to go to work and or do other things in the community. So you would have to wear a mask for those remainder 10 days.
All right. So how about this? Does the number of symptoms change how long you should stay home? Like, you might not have fever or anything like that, but you might just have a lingering cough or something.
No, actually, we want you to stay home. That at least that minimum of 5 days, you should just buckle down and try to have your family bring food over. The other things that you can do to help around the household is to you yourself wear a mask, and if you could be isolated away from your other family members so that your other family members don't get it.
All right, and what should you do if you were exposed to someone who tests positive? I know we kind of went over this just a little bit, but I want to make sure that, do you isolate and then stay home for those 3 to 5 days while you're going to test in that time?
Yeah, so ideally, we want people to quarantine after your exposure, but we realize that's not completely possible for everybody. And so the alternative is definitely wearing a mask wherever you go. So that minimizes that risk that, if you're becoming positive after that exposure, you're not giving that to anybody else as you start to mount having virus in your system.
Okay. All right. So now is your chance to get your COVID question answered. Dr. Snider is taking your questions until 6 o'clock. Now here's how you get your question to her. The number is 336-379-5775. Remember, this is an anonymous question. No one's knowing that you're the one who's asking the question, but you do get your question answered in real time. We'll be right back after the break.